Hello AS, welcome to the second part of psychopathology. Today we're going to be looking at the behavioural explanations and treatments of phobias, and you'll be pleased to hear there is no new information in the AO1 of the explanations of phobias, and there is information that is being recapped in the AO1 for the treatment of phobias as well. So I've tried to keep this, because it's the last topic, I've tried to keep it as linked to old information as possible to make your life easy as possible, or A2 information to prepare you for next year, but also make your life easier next year as well. So, if I can get my mouse working, there we go. The two-process model is the behavioural explanation for phobias. So behavioural explanation, all of our behaviours are learnt from our environment, and then there's a two-process model which, helpfully enough, explains how phobias are developed, and it suggests that classical conditioning helps you acquire a phobia. So classical conditioning, which is learning through association, helps you acquire a phobia, and operant conditioning helps you maintain a phobia. So learning through consequences is what maintains a phobia as well. We'll start with classical conditioning, and we're going to look at dogs. So classical conditioning, learning through association, suggests that the process would work like this. It suggests that an unconditioned stimulus and a neutral stimulus are paired. So the neutral stimulus is associated with the unconditioned stimulus, and therefore you will develop a learnt response to the neutral stimulus. Okay, so the key thing you need to talk about there, you need to explain, is that the unconditioned stimulus is associated, or the neutral stimulus is associated with the unconditioned stimulus. For example, the unconditioned stimulus would be a dog biting you. The unconditioned response would be fear. The neutral stimulus, the stimulus that I had no response to at first, would be the dog. So just a reminder, unconditioned stimulus, unconditioned means unlearnt and natural. So a natural response to being bitten by a dog is feeling fear. And then a neutral stimulus, so a stimulus that has no response. So children aren't born with any particular response to animals, to dogs, at all. Okay. The neutral stimulus is paired with the unconditioned stimulus. So the dog is associated with the dog bite, and therefore the dog becomes the conditioned stimulus, and the conditioned response to seeing a dog is fear. And there you go, you've acquired a fear of dogs. So remember, the first step, classical conditioning, the first part of the two-process model is acquisition. That word is really important, acquisition. Okay. The only additional new information that we've possibly already touched on as well, I'm pretty sure I've spoken to you about, is stimulus generalization. So something that happens with phobias. So for example, the dog, if you were bitten by a chihuahua, you wouldn't just develop a phobia of that particular chihuahua or all chihuahuas. The stimulus would generalize. So you'd be afraid of small dogs and big dogs, all breeds of dogs, and you possibly might even branch out further into cats or to other animals. So your fear is generalized. Stimulus generalization, that fear becomes generalized. Okay. Operant conditioning is where is how you maintain the phobia. So operant conditioning, learning through consequences, and specifically we're looking at negative reinforcement. Negative, removing a stimulus; reinforcement, a behavior is increased. So the negative, the stimulus, the thing that is being removed, is the removal of the feeling of fear, and the reinforcement is the avoidant behavior. Okay, so for the example of the dog, and we've looked at this example before, somebody with a phobia of dogs, they might be thinking, I've got to walk home from college, but I've got to walk past that dog that always makes me jump when I walk past the dog. It's very scary. I'm scared of them, got a phobia, don't like them. So you'd be worrying about it the whole time, building up to it, worrying, and the last minute you decide, instead I'm going to walk 5 minutes longer so that I can avoid the dog. And suddenly that rush of release, that removing of that stimulus of fear, the removal of the fear stimulus itself, reinforces the avoidance behavior. More likely tomorrow you're going to walk the further route, and the day after you're going to walk the further route as well. Okay. Social anxiety is a really, really good example of this one. You're worrying about doing your presentation in front of the class, or meeting new people, or going to a new place. You worry about it until you decide in the morning you're going to ring in ill and not go in. So that's and then immediately feel that release. You're removing that feeling of fear, and you're increasing the avoidance behavior. Okay, that is all you need to know. You need to be able to. So then 2 key new things that we have discussed and covered with the 2-process model are the words acquisition and maintenance, and that is pretty much it. The only other additional thing might be the concept of stimulus generalization and placing them together. However, that is it. Evaluation of the 2-process model, just to confuse you now, because approaches and explanations are slightly different. We're going with SPID instead of SPEC. You've done SPEC, you're all good with research methods and those things. Now we're starting to move you into the year 2 stuff, and the I stands for issues and debates, which is a whole topic within the 2nd year. So SPID, supporting evidence, practical applications, issues and debates, and oh no, it's not SPID, it's SPIC, isn't it? Oh, apologies, 1 second. There you go. So please don't panic too much. It's not changed too much. It's just the I that's changed to issues and debates, and then the C is still the contrast to alternative. So alternative ways of explaining phobias. So first one we have supporting evidence is Little Albert. Watson and Rayner in the 1920s did a very famous study where they got a small child who had no fear of white rats. So he was tested, they presented him with the white rat and he displayed no fear, so it was a neutral stimulus. However, then what they did is they paired the unconditioned stimulus of a loud noise with the neutral stimulus of a white rat together, and to elicit a fear response. So let me go through that. So every time the white rat, the neutral stimulus, went near Little Albert, they banged, Watson and Rayner banged a hammer on a metal bar and it made a really loud noise. And obviously Albert, the natural response having a really loud noise, especially if you've got delicate little weak child ears, is to start to cry, feel fear, it makes you jump, it's not very nice. The neutral stimulus of the rat was paired with the unconditioned stimulus of the loud noise, so eventually the white rat became the conditioned stimulus and the conditioned response became feeling scared. So Little Albert developed a phobia of white rats. There's also supporting evidence within what Little Albert for stimulus generalization. He developed a phobia of rabbits that weren't white, Santa's beard, cotton wool, and fur coats. So he'd generalized white fluffy things or just fluffy things. His fear had generalized stimulus generalization. Okay, have a think about what supporting evidence tells us about an approach and explanation. Practical applications, exactly the same for this one. So now we're going to, and at the next slide, we're going to start talking about systematic desensitization and flooding, which I did briefly introduce you to. So I'm not going to mention it much now, but I would like you to return and make notes on this one later on in the video. So listen to systematic desensitization, come back and make the notes on there, and then come back and add more details. But a practical application is of the 2-process model, and the behavioural explanation of phobias altogether is systematic desensitization, which is where you do counter conditioning. So you, at the moment, you are conditioned to have a fear of dogs. However, systematic desensitization counter conditions you to, instead of respond with fear, you respond with feelings of relaxation, and we'll look into that a bit more so you can summarize that. And then issues and debates. An issue with the behaviorist explanation of phobias and treatment of phobias is that it is very reductionist. So the assumption is, particularly if you want to remember some terms from A2, environmental reductionism. So that means that it's reduced the explanation down to its simplest form and is therefore ignoring all other explanations for why a phobia might develop. So, for example, there's a psychologist called Wolpe, W-O-P-L-E, who worked with a patient who had a fear of insects. He kept trying systematic desensitization on her, lots of counter conditioning treatments. He assumed because she'd learnt the phobia, she could learn to associate insects with relaxation instead of fear just as easily, so you could counter condition it. That wasn't working, and eventually it was found out that actually the reason for her fear of insects was because her husband had a nickname that was related to an insect, and she was experiencing marital problems at that point. She wasn't getting on with her husband. So a problem with the behaviourist approach is that it ignores factors such as biological factors, social factors, cognitive factors. It doesn't consider our thought processes at all, so it's very, very reductionist, doesn't consider other factors, and therefore suggests that it lacks validity. So if you remember, for all of these, you've been doing it enough times now, you know that you need to link them back to validity. And finally, contrast to alternatives. So there's two other explanations or things that could explain phobias that aren't just the simple two-process models. There are other ways of explaining it. So there's the diathesis stress model, and this is the idea that you have to be born with a genetic propensity, and we've already talked about this one as well, so I'm just trying to keep you doing things that you are already aware of. So you're born with a genetic propensity towards having a phobia, for example, a fear of spiders, and we'll talk about why that is in a minute. And then you also have to have additionally enough environmental stimulation or environmental experiences to develop that phobia. So you could be born with a genetic propensity, because you never meet a spider or have no negative experiences, then you do not develop a phobia. The same with, you could be born with no genetic propensity, but if you have enough environmental stimulus, enough negative experiences, you will develop a phobia of spiders. But normally it's in the middle, so somebody has a genetic propensity towards a fear of spiders, which makes them vulnerable to developing that fear, and then they have some negative experiences. So a spider running across in front of them on the room, making them jump, or them moving around in a scary shed, feeling very nervous, and spiders crawling on them, and things like that. So very negative experiences. Or biological preparedness, which again the behaviourist approach cannot on its own explain. It's the idea why some phobias are explains why some phobias are easier to explain than others. So develop than others. For example, we've already used this. It's very easy to develop a phobia of spiders, snakes, heights, because they are all having a fear of them is evolutionarily sensible. It's an adaptive trait. By avoiding snakes, spiders, heights, you're more likely to survive and therefore reproduce and pass on that genetic propensity towards the fear of all those dangerous things. So it is very, very easy to trigger a fear response through environmental stimulus. However, it's very, very difficult to develop phobia of, insert anything here, straws, felt tips, clocks, buttons, whatever you can think of. It's more difficult to develop the phobias because you do not have the biological preparedness. There is no evolutionary advantage to being scared of buttons. They don't save your life or put your life in danger. So behaviourist approach cannot explain things like that some phobias are easier to develop than others, and that's because there are other ways of explaining that through the biological preparedness. Cannot explain why some people develop phobias and some people don't, and that could be linked to the diathesis stress model. So there are alternatives which can explain behaviours more effectively, therefore increasing the validity. So I want you to think about the wording of that one, because you wouldn't just say contrast to alternatives. That's just to prompt your memory. So on to the treatments. So now we know what causes phobias, we can talk about what treats or reduces phobias. So as I mentioned already, we have systematic desensitization and we have flooding. So systematic desensitization, really those two terms should be the other way around, is based on the idea of counter conditioning. So behaviourists believe that you learn a phobia by associating the unconditioned stimulus with the neutral stimulus, and therefore developing a conditioned response to the neutral stimulus, which then becomes the conditioned stimulus. So the belief is that the fear can be learned, and therefore the idea is that we can counter condition that fear, so people can learn to associate their fear stimulus not with anxiety but with relaxation and feelings of relaxation. And it also works on the idea of reciprocal inhibition, so the idea that you cannot experience two intense emotions, you cannot maintain them, you can't experience two emotions at the same time, and also the idea that anxiety cannot be maintained. So if you are working, and in a minute you will see that relaxation is something that is the key focus of systematic desensitization. If you are feeling intense anxiety but you are also working to experience relaxation as well, your body cannot maintain both of those, so one of those experiences must be removed, and it is much, much harder for your body to maintain anxiety. Anxiety is also inhibited by relaxation as well. So you cannot be both relaxed and anxious at the same time. That forcing yourself to feel relaxed, it then challenges the anxiety that you are feeling. So this is the step-by-step process. I've taken this directly from a mark scheme, so you need to remember each one of these steps and include all of them, and this will explain this image in a minute. So first of all, a psychologist would teach you relaxation techniques. For example, meditation, mindfulness, deep breathing, visualization. So imagining that you are somewhere else you were in a beautiful beach that's nice and relaxing, wherever your happy place is. Like say, breathing techniques to bring your body back and relax yourself with your breathing. And in extreme cases, they can provide you with drugs. If you are struggling, then they can provide you with a sedative. The next thing you will create, which is the image just here, is you'll create an anxiety hierarchy. This is where you make a list of everything from from the most intense interaction you could have with your fear stimulus to the least intense one that you could have, and then then we'll talk about what happens next. And then you rate it on a scale of 1 to 10 or 1 to 100. You can choose. So thinking about a spider would be 10. Looking at a cartoon picture of a spider might be 25. Looking at a real spider in a closed box is 50. So you would be asked in the process. You would be asked by your therapist to place yourself on the scale. Okay, so the next step that comes, you've learned how to relax. You can use that really effectively. You've got your anxiety hierarchy or your fear hierarchy, you can call it either. Next step is exposure. So this is where you are exposed to the first step of your anxiety hierarchy, the lowest negative experience that you could have with your fear stimulus. So thinking about a spider. Then what would happen is you must relax fully, and without that you do not get the full marks on the mark scheme. So you're exposed to the first thing, thinking about a spider, and your fear rating is 10. You then implement your relaxation techniques until you are completely relaxed, and the therapist will ask you to rate your fear. So you will experience something for a moment, you'll be reminded to use your relaxation techniques, and then the therapist will say to you, what do you feel? And you're like, oh, I feel like a bit like a 5 now. They say, great, keep going. And eventually go, nope, don't feel any fear at all. They say, great, we're going to move on to the next stage in your hierarchy, looking at a photo of a spider. Same thing, look at it, use relaxation techniques, wait until you are fully relaxed, so you have moved all the way down your fear, the fear rating. You feel no fear, you are completely relaxed, and then we move on to the next step again. Do not forget that you relax at each stage. Okay, sounds like a really simple thing, but having taught this for a long time, I know the things that students forget that are absolutely key for the mark scheme, and that is systematic desensitization. Systematic, gradual, slow process desensitization, so removing that fear and replacing it with a feeling of relaxation. Flooding, however, is very, very different. Same thing again, it talks about counter conditioning and reciprocal inhibition, so the idea of replacing the learnt fear response with a learnt response of relaxation. So they teach you the same relaxation techniques, possibly breathing techniques, meditation, mindfulness, visualization, yoga, anything to relax you, or even in extreme cases, sedatives. And then you are immediately exposed to your fear stimulus in the most at the highest point of the anxiety hierarchy. So if you were scared of spiders, it would be holding a tarantula. If you were scared of heights, it would be parachuting out of a plane. If you were scared of snakes, it would be holding a snake. All of those different things, you would be immediately exposed to them, and you would not be allowed to leave until you have completely relaxed and mastered your fear. So one session can take a very, very long period of time, up to 2 or 3 hours. So until you're in a relaxed state, and like I said, you are not allowed to leave, which is called unavoidable exposure. So immediate exposure and unavoidable. You cannot leave remove yourself from the situation until you are fully relaxed. And this could be in vivo, which is in reality, so you can physically have the spider in front of you, or you can do it through virtual reality. So in vivo, actual exposure, or virtual reality. So either imagination or now obviously we have some incredible technology which allows us to experience things virtually. So they're the two types of treatments. Evaluations of treatments, this is a new one again, so this doesn't fit with SPEC or SPIC, which is the one we did last. This one is REST. So R, relapse rates, E, effectiveness, S, side effects, and T, time taken. The whole time with all of these, you do use the P structure. Okay. So here you do need to know, unfortunately this is the only one where you need to be able to evaluate both systematic desensitization and flooding. So you could be asked a question about systematic desensitization specifically or about flooding specifically. So relapse rate means after a period of time when we return, how likely are they to still be experiencing their phobia. So REST isn't necessarily the best order to present them in, because actually effectiveness would be better to introduce first before relapse. But obviously REST helps you remember the structure, the structure quite easily. So Gilroy found that people with spider phobia were both 3 months and 33 months later were much less likely to experience the intense feelings of fear that you would get from a spider phobia as the control group were, who were only taught relaxation and did not experience the exposure that would come from systematic desensitization. And that was rated on something called the Spider Questionnaire, and you can find that in the Green Haired Girl book, which is in class on page 147. As well. So it suggests that in comparison to a placebo, so not having the treatment, there is a reduced relapse rate. There isn't a very high relapse rate. Effectiveness, so McGrath in 1990 found that 75% of participants with a phobia did respond to systematic desensitization, and this seemed particularly significant with actual in vivo exposure as well. And a weakness, however, is side effects. A weakness is that you can experience side effects. For example, symptom substitution. So Little Hans, which is a case study by Freud, which we look at in the second year, had a phobia of horses, or that's how it appeared. So I know we've introduced two Littles, Little Albert and Little Hans. I remember Little Hans because of the H for Hans and the H for horse. So Hans had a phobia of horses, it would appear. However, when Freud dug a bit deeper, it turned out that he had some unresolved issues around his relationship with his father. So in that case, if you had treated, instead of treating the root cause, if you treated Little Hans' phobia of horses, you might just find that then the feelings of anxiety and fear were just, the symptoms were substituted, they were placed on something else. You might have developed a phobia of cows or dogs or cats or school, could be absolutely anything. So symptom substitution. And then T is for time taken. So systematic desensitization is not quick, it is the opposite. So apologies, I've just swapped that round. So yes, a weakness of systematic desensitization is it does take a long period of time, and it can take well over up to and beyond 10 sessions of systematic desensitization to be effective. So you have to think about, we've looked at the implications on the economy. If it takes a long time, chances are it costs the NHS a significant amount of money. Right, and then flooding. So Thom in 2000 found that when he tested or compared people who had a phobia of dentists, the whole sample had a phobia of dentists. Some of them were given a drug treatment, so they were given a drug treatment to relax them, a sedative, and the other group were given it had one treatment of systematic desensitization, and Thom found there was no relapse rate. So nobody from the flooding condition, from the flooding condition displayed any continuing symptoms. However, the drug treatment condition did show continuing symptoms of dental phobia, of dentist phobia. So there was no relapse rate in the flooding scenario, but there was in the drug scenario. Effectiveness. Choi 2007 found that comparing systematic desensitization and flooding, that flooding was the most effective treatment for phobias out of those two. which is a good sign. Pittman in 1991, thinking about the side effects, so he found that potentially flooding, because it can be quite intense. I wouldn't talk about it breaking ethical issues because there's lots of informed consent involved, participants fully aware of what they're letting themselves in for. There's no ethical issues. However, it can be incredibly distressing at the time, and it can be very challenging for participants. So side effects have been that they found increased symptoms of depression and also a relapse of alcoholism. So the sample that Pittman looked at was people experiencing PTSD and anxiety, and he found that they had a relapse of alcoholism as well. So it could have a negative impact outside of the phobia and outside of the therapeutic environment. And then finally, time taken. Well, a strength of flooding is that it's very, very quick. It's in one session, and admittedly it can be a long session, but one session it's done, and that should then reduce should treat your phobia completely. There is debate about how much it does that, but it should treat your phobia completely, and therefore could potentially be considered quite cost effective. Okay. And also suggest that generally it's an effective treatment, therefore increasing the validity. So that is a whistle-stop tour of explanations and treatments of the behavioural explanations of treatments of phobias. Thank